Somebody can now be clear of SIBO, but they're still symptomatic. But when you get that lactulose breath test back and it says, well, the SIBO's gone, there's no hydrogen, methane, you know what I mean? Those are negative, but they still are having trouble. Now you have to go look for celiac disease, food sensitivities, gastroparesis if they're still not emptying, Lyme disease, whatever it is. But you can clear those gases and people can still feel bad. I think it's really important to make sure that we're testing in between and not just going off symptoms. And early on, I was guilty of the same thing. It's like, oh, you're a textbook case for SIBO. But just last week, I saw a negative lactulose breath test, but a lot of dysbiosis in the large bowel. Well, she doesn't need the SIBO treatment. She needs to work on her large bowel. And, you know, they're not the same.
Hey folks, it's Mike Mutzel here with highintensityhealth.com. Thanks so much for tuning in. Today we're going to talk about SIBO and farm living with nutritionist and functional medicine expert Tracy Kanoski. She went to Bastyr University to get her master's degree back in 1998. So she's been doing this for quite some time. She's got a great story. She's been following the SIBO research and helping her clients overcome small intestinal bacterial overgrowth. So we're going to learn about that and also her life on the farm. So Tracy, thanks for being here.
Yeah, thanks for having me, Mike. I'm honored to be here.
Thank you. To know each other through an online course that we did, this spring. And so I would love for you to maybe start off with your clinical practice and share with our listeners your life out in Montana on the farm and kind of what that's like.
So after Seattle, I'm a native Montanan. So I moved back to Montana. I had a face-to-face private practice. And 5 years ago, I just went 100% virtual. And we live out in the country a little, which you know. And I had traveled a lot before I moved here. And when I moved here, I didn't even want to drive 30 minutes to go to downtown Billings, which is our biggest city. And so I hired a business coach and said, I want to work from home. And she said, I think you can do it. And she said, I think you can be 100% virtual. And I really spent the first year thinking I'd end up at Walmart, that this just wasn't going to work. And now I have a full thriving private practice. And we do live on this little farm. So we have cows, beef cows, not dairy. And so we calve every spring, and we just got into chickens, and we have a horse, and we have goats to try to manage the property with as few chemicals as possible. So the goats, they're supposed to eat the weeds, but they
don't always do that.
Horses, and they follow the horse around, and they've kind of become just small horses, and they want to eat grass and hay. Thank you, but it's all really fun, and I'm really, really blessed that I can have the life I want. You know, we have a huge garden. My husband's passionate about all this, so he's out there growing blackberries and asparagus and learning about ladybugs for, bug control. And he's just really on board. And so we are doing our best to raise as much of our own food and manage our life that way.
So do you have a lineage in your family of farmers, or did you guys kind of learn this as you went?
We're definitely learning as we go. It's not all so easy. We have 35 acres. And I mean, if I could go to class, the class I'd probably go to at this point is how to manage 35 acres without bills. Because when you call, let's say we have a lot of mullein, you have all these weeds. And when you call the county extension, they just say, oh, come get this, this drug. I mean, it's just like calling the vet or the doctor, and they say, well, take an antibiotic, and you want to manage the land differently. So no, we don't really come from that. We read and do what we can. And Montana isn't exactly the mecca of doing it natural. Some cities in Montana are, but where we are, I feel like is pretty conventional. So we are figuring a lot of stuff out as we go.
Oh, that's great. So have you noticed any health improvements since you started growing a lot of your own vegetables and you're having, eating off the land, so to speak? Have you noticed any changes in you or your husband's health since starting to really take that seriously?
So disappointingly, I think I'd have to say no, but it also maybe hasn't been long enough. So in that 5 years, we've just have the cows, that's kind of a process to get cows and start keeping and eating your own. It takes 2 years to raise a steer to where you can butcher them and, and then pretty serious gardening the last 3 years. So it has tremendous benefits in terms of saving money. We buy heirloom organic seeds from rareseeds.com and, but if we weren't doing that, we're still buying organic at the grocery store. So I don't know if I feel better eating our own food, except emotionally.
Yeah, because it's a labor of love and you're putting
Mhm.
all that effort into it. That's great. So, any tips for people before we get into SIBO? For people that maybe are curious about growing their own vegetables, maybe having some chickens and starting out small, any tips or resources or websites or, words of wisdom that you could share with them?
Well, I think anybody can do a raised bed. I almost don't care where you live. Anybody can do a raised bed, even if it's only 2 feet by 2 feet. And you can make your own soil, which is what we did for our raised bed. So you start out with cardboard or newspaper and put in leaves and twigs and leaves and twigs. Oh, because we have cows, we put some manure in. But whatever the size of it is, you can grow all of the salad you want for a summer in 2 feet by 2 feet because you just keep replanting every couple of weeks. So I think anybody can grow a few things. And chickens, a lot of cities allow you to have 3 to sometimes 10 chickens as long as you don't have a rooster. And then you get to use the chicken poo for fertilizer, and it makes great fertilizer. So we're new to the chickens, but we are harvesting chicken poo. We have a method of capturing it all. And so I've made a bucket of slimy stuff.
Yummy.
I go pour on my, all the squash, and anyway, we'll see. But I guess I would say anybody can do something. Everybody can do something, whether it's a tomato plant, a pepper plant, share chickens with a neighbor, but I think we all could be a little better in charge of our food supply.
Great tip, sir. All right, so let's talk about SIBO. You've been studying SIBO for quite some time. A lot of people seek you out for, small intestinal bacteria overgrowth treatment. Maybe give us a little bit of an overview. We've talked about it, Tracy, a little bit on the show and in different segments from different practitioners, but give us your take on what SIBO is and the different types of SIBO, if you will.
Sure. So SIBO is an overgrowth of bacteria in the lower small intestine typically. So a lot of people don't know that the small intestine really should be almost sterile. There's virtually no bacteria residing in there, 10 to the third. When we talk about the microbiome and the gut flora, we're really talking about the large intestine. And I'm not really sure if the average consumer gets that we're talking about, almost two different, it is two different organs, I guess, or, at least pieces of anatomy. So that small intestine should be sterile for a variety of reasons, which I think we'll talk about. The colonic bacteria, the large intestine bacteria, can migrate up into the small intestine. I explain it to my patients like this. It's like mom and dad are gone. The kids invite a few friends over. It turns into a massive keg party. Nobody gets their work done because, the small intestine is where we should be doing our digestion and absorption. So when everybody's having a party in the small intestine, nobody's digesting and absorbing your food. So we now know that there's 2 types of small intestine bacterial overgrowth. There's SIBO hydrogen. Those people tend to have fast transit time and loose stools. We have SIBO methane. Those people have slow transit time. They're maybe only having a bowel movement a couple times a week, every other day. God forbid once a week, but something like that. And they also might have those hard, compacted little stools. So now that we know we have 2 types, there's also 2 different treatment protocols for that. SIBO hydrogen gets 1 antibiotic. SIBO with methane, whether it's hydrogen and methane or just methane, gets double antibiotic therapy. So, I'm sure we're going to talk about some of the things that go wrong in this, but there are 2 types. They do have different treatments. Almost like type 1 and type 2 diabetes. They're different entities on some level. So it's an overgrowth and the work's not getting done and it wreaks havoc. We're all trained that if the gut's not working well, then you end up with brain symptoms, you have fatigue, you can have joint pain because the gut is now spilling out those endotoxins. They get into the bloodstream and they go everywhere from head to toe. So people really, they have this plethora, but there can be a very textbook case and it's very easy to identify if you know what to look for.
Great overview there. And if we could talk about some of the causes, we've had Steven Samberg-Lewis on, I think it was episode number 8. And so he talked about different medications, popcorns, opiates, stress, and so forth, working with clients and so on. What have you found to be kind of the top offenders, or when you're going through someone's, using the functional medicine matrix and digging into their story, what have you found that you feel are the top offenders or, lifestyle factors that contribute to SIBO development?
Right. Definitely not a one-size-fits-all. So Pimentel has showed in the research that stress can contribute to, but in military studies where people are highly stressed and have PTSD, but they don't necessarily get SIBO. So foodborne illness is now known to cause 25% of SIBO, so meaning you get food poisoning. Stress can contribute. I see and look for head injuries. A lot of that comes from Datis's work, Datis Carazon, and I think you've had him on too. But if your brain's not working, guess who tells your gut what to do, So
Right.
you have to look for that brain stuff. So head injuries, falling off a horse, falling down the stairs. Even if you were 3, these are, I did have a patient who has lifelong SIBO. She fell down the stairs at 2 or 3 or something. She's been constipated her whole life. And you can't miss that in a history, because that really can be a reason. She could have damaged her head, the vagus nerve. It drives motility all these years. I think low hydrochloric acid can certainly be a player. PPIs, so we're in an epidemic. It's usually in the top 3 of drugs being prescribed. So too many people are on a proton pump inhibitor. Poor diet. Can't miss that, right, as a nutritionist. And I personally have to wonder what genetically modified food and pesticides and herbicides do in all of this. There's no research that I know of that indicate those, but you have to wonder if this becomes either a brain disorder where your brain can't drive the gut, or it becomes a gut disorder. What do we do all day? That's a little bit like saying food doesn't have anything to do with your Crohn's to say that GMOs don't have anything to do with SIBO. That's just a Tracyism, but it feels like, if we're wrecking our gut and wrecking motility or whatever, that's just...
Yeah, definitely. I'm fascinated to kind of explore this kind of top-down approach and a little bit further. I know you want to kind of talk about that towards the end and so forth, but I think that's a great point to kind of launch from, because like you said, I mean, who hasn't had some sort of small accident that maybe we brushed off or our parents brushed off, or, from football and sports. And gosh, I've hit my head a million times. I used to race motorcycles. And so what sort of maybe assessment modalities or treatments would you offer for brain-based therapies to help people kind of restore that vagal nerve and get the gut-brain axis functioning properly?
So in my mind, Datis has sort of started that. I'm really thankful that he's done that. But so, I'm not a physician, but so he talks about assessing for bowel tones, looking at the palate and the arches in the back of you open your mouth and say, ah, and looking at those, because the palate is fired by the vagus nerve, and so you would see those either lopsided or not firing at all. But let's make sure the listeners understand what the vagus nerve is. So the vagus nerve comes out of the head, comes down behind the ears, kind of comes back behind your throat. It's part of speech, goes down, sort of joins up as one, and then turns into this mesh that's, I think of like a big spider web, and it encapsulates and surrounds the heart and almost the entire digestive tract. Starts in the stomach, small intestine, I believe goes about halfway through the large intestine. So when that's what people need to understand, is that when you and I are talking as educated people about the brain gut axis, that's what we're talking about, is that vagus nerve has a critical role. So Datis has opened the door about gargling, gagging, coffee enemas. Acetylcarnitine was discussed in this year's SIBO symposium, because the vagus nerve is an acetylcholine-based nerve. And then one person mentioned lion's mane. It's a mushroom, and it also has some nerve regenerative properties. So I am having my people do that. I mean, I think we're just now on the brink of figuring out whether people do have vagus dysfunction. I sort of assume all my patients have some vagus dysfunction, and that they could all stand to do some gargling and gagging, and if they want to venture into coffee enemas. Most people with SIBO do have cognitive dysfunction, and acetylcarnitine works great for brains. And now we have kind of this double mechanism where it has 2 benefits. Just helps the brain fire and also helps that vagus nerve fire. So I am doing a lot of that in my practice to try to address that, because as you maybe know, and as a lot of people who are going to end up watching this know, a lot of people have SIBO and they treat and retreat and retreat ad nauseum. And we have to start thinking about, what caused it? Is it the vagus nerve? Is it, all the other things, or, and how to fix those, and not just keep giving people herbs or antibiotics or whatever for the rest of their life.
Yeah, I'm glad you brought that up because that's a common question that I get all the time, and through email and through people that I interact with and so forth online is people have been on the antibiotics, whether they're the Xifaxan or rifaximin and or berberine and herbs and peppermint, and still have not received beneficial improvements. They're still symptomatic. So I love these very practical and inexpensive brain-based approaches to really restore that brain gut axis, which is great. I think anyone can benefit from firing their vagal nerve, even if you don't have SIBO. I mean, there's a lot of research showing that vagal nerve activation is great for helping to keep the integrity of the gut there and helping to improve digestion and motility and also even weight loss, believe it or not, in autism. So there's some research using vagal nerve therapy for autistic children. So fantastic. And what have you found, if we could kind of go into like heart math and stress-based reduction, mind-body therapies, have you found that to be helpful in the context of SIBO and gut health?
So I try to get people to do that, and I have the little heart math gizmo and do my best to get in the green zone, right? But feels like a work in progress. Now, Dr. Pimentel says that the ICC nerves that are in charge of innervation for the migrating motor complex, again, we sort of dived ahead here, but that those can replasticize in 3 weeks. So let's break that down. So we've got the brain, the vagus, and then the vagus fires. I probably don't have all this right. I'm not a neurologist, but the vagus to maybe the interstitial cells of Cajal, and those fire the migrating motor complex. And all of that is part of motility, right? So if those are damaged, whether that's food poisoning, a head trauma, maybe Lyme disease and autonomic dysfunction, but if those are damaged, that we can replasticize that. And what that means is that if you have a tree here and these are its branches and this is a tree and its branches, a nerve fires its neurotransmitter, it goes across that synaptic gap, and then it gets picked up by the other one. So that's what we're talking. When a nerve fires, somebody literally fires, the nerve fires, the neurotransmitter comes across, it gets picked up here. Replasticizing, if this gets broken, whether it's Alzheimer's or, that head injury, if this gets broken, if it doesn't go too long, these can regrow and it can find another way over to reconnect. And that's what happens if somebody has a stroke and they have to learn how to walk or talk again. That's replasticizing those nerves. And so I don't even remember where we were going with that, but that's
we were going with takes, I think, 3 weeks to get the vagal nerve to replasticize.
Yes, right. So I am having people do that. Most of my patients, I feel like, no disrespect to them, but I feel like they maybe don't take that seriously. They think, yeah, like you just want me to gag and gargle and you do your best to convey all of this, but I don't, I think it's a big deal. I think it, sometimes you have to hit that rock bottom before you start to do all of this. So if you've been on antibiotics 3 times and you're eating to the letter and you're doing everything right, you have to start thinking out of the box and thinking about these other mechanisms that are involved. That's what it takes before people start doing heart math and deep breathing, whether it's with or without the gizmo. And just for science, let's just make sure everybody understands that if you're in stress, fight, or flight mode, you're decreasing secretory IgA. And here's the analogy I give my patients. If you're in the woods and you had a nice picnic lunch and here comes a grizzly bear, do you think you're going to worry about digesting your food, or do you think you're going to worry about running away from the bear? Well, of course you're going to run away from the bear. And so that food just sits there and ferments, and and you decrease secretory IgA. So stress really is a big player. Maybe that's why SIBO is such an epidemic, even outside of all of Pimentel's research. If it's such a predisposing factor, who's not stressed these days, Even retired people are too busy. So what does that tell you?
Yeah, no, I completely agree with that. And I think the buy-in is tough for the mind-body stuff because it takes a lot of dedication and practice, and the effects are not so immediate. Sometimes when you take a supplement or herb or a pharmaceutical, you can notice the results right away, and it's more of a passive, modality, if you will. I mean, you're swallowing a capsule or a pill or something along those lines. But the mind-body stuff, I think, has the best long-term effects I've noticed through my own health, doing heart math and meditation.
Right.
I love supplements. I take a lot of supplements, but I think that is the one thing that I would never want to give up because the effects are so profound. But it took me a while to be dedicated to that. So I can see why some people may resist that. But if you're listening to this and you've been fighting it, I would suggest starting there, because I think it's the most powerful, and research really shows that. So, and back to the stress thing, you hit on secretory IgA and digestion, and I just wanted to highlight for folks, about bile and how antimicrobial bile acids are and how they help to keep, bacteria out of the small intestine. And so bile is one of those digestive products, as you know, Tracy, that's going to be the secretion of which will be diminished during times of stress. So you have all these things going in the wrong direction when you're stressed. And so I like that idea of just gargling and calming down even before a meal. If you don't make that your therapy, can really help you digest your food.
And let's not forget, you asked me about risk factors, but having your gallbladder removed is a risk factor for SIBO because it changes bile flow.
Interesting. I didn't know that. So I guess we didn't really talk about assessment. So you're seeing a lot of people, virtually and so forth. How are you assessing SIBO? Are you having them, ship a test or go to a treatment center? Can you talk about that?
I can do both. So somebody signs for me and I can do the lactulose breath test. I also work really hard to work with providers. I feel like it's just like if you have your daughter come help you make broccoli in the kitchen, she's going to be more likely to eat it, right? So if I see this and I can have the provider, doctor, nurse practitioner, whatever, order the lactulose breath test, then they're a lot more inclined to be on the team when it comes to treatments. So I write plenty of letters, but so the answer is both. I can both order it and I can also send them back, and it's really a case by case basis.
Sure. Okay, fantastic. So let's talk about food. I know you work with people a lot about getting off FODMAPs and more simple carbohydrates, I think, but and maybe prebiotics, probiotics. People get really confused. Should I totally avoid fermentable carbs? Should I avoid prebiotics? Like, share with us, some of the dietary recommendations to avoid SIBO, and if you have it, how can it improve your gut?
Okay, so you can't fix SIBO unless you do either a low FODMAP diet or the combo that Dr. Seebecker put together, low FODMAP and specific carbohydrate. What we're trying to do is reduce the fuel that the little bugs have to eat. So it at least has to be low FODMAP. A lot of people have lost the ability to digest disaccharides. So that combination, that is what I use. It's more extreme, more restrictive, but you're going to get better results if people eat off those left two columns, the green and the yellow column off that Dr. Seebecker handout. So you have to do the diet. I have a huge opinion at this point, and my opinion, over the 5 years I've studied SIBO, I've certainly learned a lot, and I've anybody who I helped 5 years ago, I've probably changed my methods, but I no longer believe that we should be using pre or probiotics for SIBO until we know if their migrating motor complex works. So this maybe is a great time to talk about that smart pill, because that's how we're going to know if their migrating motor complex is working. But just to make sure people understand, people are going to come from all different levels. If you don't have good motility, and migrating motor complex is like a sweeper in the small intestine, and you can actually have good motility. You could be having 5 bowel movements a day, but the migrating motor complex can be broken and you're not sweeping out all the garbage at the end of the day. So if that migrating motor complex is not working and you are giving pre or probiotics, you're just feeding the fire that you've tried to put out. So I have a huge thing about that right now. And I see it all the time. I see people on Instagram and Facebook saying, I'm seeing somebody for SIBO and I'm on BSL-3. And I just think, are you kidding? I mean, for a while, maybe you're going to outnumber the bad bacteria and all the stuff in there, but it doesn't hold up yet until we know about the migrating motor complex.
So let's talk about the smart pill. I'm curious now.
Hey, fast. We're living in the future, back to the future, I guess. So it's capsule technology. I think this is just so cool. So you go to the doctor's office. You don't have to do any barium studies anymore, no dyes or anything like that. You eat a bar. The bar does have some gluten in it, which I was disappointed to find out because that's going to be difficult for some people. But you eat a bar. For some reason, that has something to do with how this carries through the digestive tract. You take this little capsule. You either wear a lanyard or a little clip on your belt. And now that capsule that you've just swallowed travels all the way through you, leaves in a couple days, just how you think it's going to leave. And it's going to monitor your pH. So we're going to find out about if you have adequate or insufficient hydrochloric acid. It's going to monitor pressure. So we're going to find out, especially about that ileocecal valve that separates the large and small intestine. It measures transit time, both from the entire transit time plus segment to segment. So we're going to find out what the transit time of the small intestine is. But in the end, you're going to have a lot of that data, and it is predictive. So Dr. Mullen just presented on it at the SIBO symposium. Johns Hopkins is offering it. It is now being covered by some insurance companies and Medicare, which I think is amazing. And it's predictive that if you have low pH or high pH, if you have an alkaline pH, if you have slow transit time, if you don't have enough pressure you have kind of a sloppy ileocecal valve, you are either at risk for SIBO or at high risk. Let's say you've treated SIBO and it keeps coming back. This is going to help you identify if it's Lyme disease and co-infections and autonomic dysfunction. Do you have a vagus nerve injury? Do you have low hydrochloric acid? I mean, that's all going to dictate future treatment. If it's a vagus nerve injury, then you need to do your gagging and gargling. If it's Lyme, you're going to need to work on Lyme stuff. And if it really is low, alkaline pH, and you don't have enough hydrochloric acid, maybe you're 70 years old and got SIBO and it's just part of aging, your therapy moving forward is going to be to take hydrochloric acid with your meals because it's antibacterial. So what we've done so far is kind of lump everybody into the same bucket. And I feel like the easy part is to identify that somebody has SIBO, and even the easy part is to give them antibiotics or herbs. The hard part is to figure out, did you get this because of 5 or 10 different mechanisms? Is this stress? You need to do heart math. Not that, again, that I think that that's the only, at least from Pimentel's research, stress alone won't give you SIBO. But I feel like if you're at risk, maybe you don't have a great microflora because you were a C-section baby, or, had a lot of antibiotics as a kid, or all those things that maybe you're at risk because of some microflora issues already, and now you're under a lot of stress. Yes, then maybe, anyway, there is definitely more research coming all the time.
Yeah, that smart pill sounds fascinating. So it's just Johns Hopkins, you said, or is it available?
Well, I don't. Yep. I don't know what other centers are offering it yet. So after the SIBO symposium, I went online, found kind of a website for it, frequently asked questions. It's how I learned that they have this gluten-free bar. And I'm now on a mission to find out what other centers offer this. Wow. But I don't know that. And I'm sure you need to go see a gastroenterologist to do it. And it's definitely going to be the cutting edge technology. But I think it's really cool that you just take a little capsule and we're going to get a lot of data out of that, you know? And if people are failing treatment over and over, you really have to look at this.
That's a big deal. Yeah, we hear about the failing treatment. So just to summarize, the smart pill can assess the root cause of your SIBO and figure out, is it a digestive issue or motility issue? Is it this dysfunctional migrating motor complex, which causes motility? Is that what the migrating motor complex does?
It's going to tell you transit time. I don't actually know, since this is so new, if it's going to tell you that the migrating motor complex is broken or it's the vagus nerve. Probably somebody smarter than me can address that, but it is at least going to tell you transit time, and that alone is a risk factor.
Okay, so you tackled some of the diet stuff, and you mentioned Dr. Seebecker's, I think it was a handout or cheat sheet. Where can people find that?
The guide that I use was available in both SIBO Symposium. I've downloaded it. I share it with my patients. I'm 100% certain that it's on her website, siboinfo.com. It's so you found the right one. It's got 4 columns. It's green, yellow, orange, and red. And as you move to the right of the page, foods become more fermentable or just plain off limits because of how fermentable they are. So I typically have my patients eat the first 2 columns, which is SCD safe and lower on the fermentable list. And again, we just don't want to feed the little bacteria. So we want to keep that fermentation down.
Absolutely. That's great. So I'll put that in the show notes as well at highintensityhealth.com/Tracy. So you guys can check that out and learn more about Tracy's work and her website. So we have the right hand out there. So Tracy, let's kind of talk about herbs. So if someone gets their test back, maybe they've worked with a clinician before. What are some of the top herbs for the different types of SIBO that you found to be most effective?
So that's been really different, but berberine, but not everybody. I have a couple people who have not tolerated berberine. I often use neem. I'm sort of following who I think the experts are. So Sandberg, Lewis, and Seebecker. So berberine, neem. I use the ADP oregano from Biotics at pretty high doses. And if they have methane, they really have to do garlic. I've not been successful treating a SIBO methane patient without using garlic. So they're either going to have to get used to garlic, or we have other options like going to the antibiotics. And some people don't even handle the herbs. They definitely don't want antibiotics. And so, for some, I've played around with some things like biocidin, which is a liquid antimicrobial. Kind of on my radar is the Designs for Health silver psyllium. Essential oils are on my radar, like doTERRA or Young Living. I'm familiar with doTERRA's line, but they have a digestin or oregano or, even ginger. But I feel like those are more powerful. And personally, I get really sick of telling people to take pills. That kind of goes two ways. People, sometimes it's like we've just substituted drugs for pills, and that isn't necessarily my favorite thing to do. So I love the idea of essential oils. Of course, there's no data, but I am using it and suggesting it more either with other things or as a last resort. If somebody fails, they just, so if you go down that whole methylation pathway, if people are homozygous for the CBS 699, even if you give them molybdenum, I do not find that they do that great with massive doses of garlic. And so you do have to kind of come up with some other options to try to help people through this.
Sure. Okay.
Oh, another option that I want to talk about, I have not done this, but just presented at the SIBO Symposium as a third option really in all of this, the third good option is the elemental diet. I have never, there just hasn't been maybe enough data on it. But so they did a lactulose breath test before, did 2 weeks of an elemental diet, which means they're only doing amino acids, there's no food, and then you do some fat and carbohydrate source with it. It's just kind of a nasty tasting shake that you drink, 3 or 5 times a day. You do it for 2 weeks. But because there's no fuel, there's no carrots, even though they're, low on the FODMAP, no cucumbers, they had remarkable follow-up tests. Like it was as effective as antibiotics or herbs. Like the data presented this year was very, very good. So I'm definitely looking at that as an option for people. You can do Vivonex, Vivonex, which is about $1,000. And Dr. Seebecker is so passionate about all of this. She figured out a formula for people to be able to make it, to just buy the amino acids, buy their own dextrose, and you can use whatever kind of oil you want, olive oil, coconut oil, whatever. And it's a couple $100. I have looked it up, and I don't have any takers on it yet, but I think it's a serious option, and a lot less money than all these herbs and antibiotics cost even. So
right. And then you're done theoretically, or hopefully, depending upon your lifestyle and I guess migraine motor complex and some of the root cause issues. But from what I've heard from Steven Sandberg Lewis is he's getting great results with that. And like you said, after 2 weeks, most people are really improved. So 2 weeks of just sticking to this.
Cowboy up and just get her done.
Done. I like that approach. Okay, so talk to us, if you would, Tracy, about some of the antimicrobial compounds when it comes to pharmaceuticals, rifaximin and Xifaxan. I know there's some different details about, where each one of those is different, how it works and the efficacy. So you want to break that down for us a little bit?
So first of all, it's important to know that Xifaxan is the brand, USA, and it's $1,250, or it was, and it's not been indicated for IBS until early June. It's now FDA approved. So for people listening, if they have IBS diarrhea or what we would call SIBO hydrogen, if Xifaxan is now approved through insurance for them to do that. Xifaxan is pretty special in that it stays in the small intestine, so it's not absorbed. It can't cause a yeast infection, can't cause a UTI. And Dr. Pimentel presented this year that they've done before and after deep sequencing, and Xifaxan leaves the microbiome intact. It's because it only works in the small intestine. It needs bile to activate it. So once it hits the large intestine, it crystallizes, dissipates, and it's gone. And in deep sequencing, they showed 98% of the microbiome was still just the way it was before you did the antibiotics. So I know antibiotics get another bad rap, but I think another important point is that this is not your normal antibiotic. This isn't Cipro or, one of those kind of antibiotics. Xifaxan also prevents other drugs that it's used with, other antibiotics, from creating resistance. So again, Pimentel has studied all this. He's the top dog. He's the one who figures all this stuff out. But if you give Xifaxan with, let's say, neomycin, or Xifaxan with Cipro, metronidazole, it prevents those from becoming resistant and losing their potency. So it's really, given that SIBO is an epidemic and we have something that works on it, it feels like kind of a big gift that we're not doing more damage. Antibiotics can create SIBO, but antibiotics can also fix it.
Basically, what I infer from that, it's a little bit more effective for the hydrogen producing or the hydrogen dominant SIBO. Is that it?
Well, or if you have methane, then you do Xifaxan plus either neomycin or Flagyl, which is metronidazole. I'm friends with a functional medicine doc, and she has taught me to not use Flagyl, or I'm not prescribing it, but to not ask a doctor for Flagyl, and instead ask for either tinidazole, or you can get compounded Tindamax. Those are the same, just because fewer side effects. And we still want to do as little harm as we can in the treatment of this. So to be clear, if you have SIBO hydrogen, you get just Xifaxan. But if you have SIBO methane or hydrogen and methane, you need both. You need that Xifaxan no matter what, if you're going to do the drugs.
Now, what's the duration of the drugs that you found or other people have found to be most effective?
14 days. It's now a pretty standard protocol to do 550 milligrams 3 times a day. I think it's important that that's not breakfast, lunch, and dinner, that's breakfast, 2 o'clock, 10 o'clock when you go to bed, so that each pill has 8 hours to work, just so that, because so many of us were taking supplements at breakfast, lunch, and dinner with food, but Xifaxan can be taken away from food, and it definitely needs its 8 hours to work. Is that what you meant in the question? Yeah.
Oh, yeah. And then duration total. So 14 days, 3 times a day.
Mm-hmm. Right. And then it's really important to retest, because here's what can happen, and I've had this happen. Somebody can now be clear of SIBO, but they're still symptomatic. But when you get that lactulose breath test back and it says, well, the SIBO's gone, there's no hydrogen, methane, you know what I mean? Those are negative, but they still are having trouble. Now you have to go look for celiac disease, food sensitivities, gastroparesis if they're still not emptying, Lyme disease, whatever it is. But you can clear those gases and people can still feel bad. I think it's really important to make sure that we're testing in between and not just going off symptoms. And early on, I was guilty of the same thing. It's like, oh, you're a textbook case for SIBO. But just last week, I saw a negative lactulose breath test, but a lot of dysbiosis in the large bowel. Well, she doesn't need the SIBO treatment. She needs to work on her large bowel. And, and they're not the same.
Since you brought that up, you have me curious, how would that treatment perhaps be different or modified for large bowel, small bowel?
Yeah. So the SIBO, that's a small bowel. That's what we've been talking about the whole time. This other patient, we're going to be working on fermented foods, chia and flax seeds for short-chain fatty acids, Saccharomyces boulardii to help her secretory IgA. I don't think she had a lot of inflammation. Diversity, you probably know this better than I do, but her diversity was really low. And I don't feel like I know exactly how, if somebody's lost the species, granted you can eat those probiotic rich foods, but I don't really know if they're gonna camp out and make a home there. But that's where we head, is to start eating fibers, diverse diet. I mean, that's kind of your forte now.
Right. Yeah. But it's interesting. Dr. Vincent Pedre was just on the show, and he's the author of The Happy Gut. And so he does a lot of stool testing for various patients of his in Manhattan. And he found that it was a couple that came in eating the same diet. They were eating the same foods. Both were mildly symptomatic. I think the wife, if I remember, was a little bit more symptomatic and had a little bit more GI upset and so forth. But the bacterial diversity was completely different in their stool test. And so, of course, you could look at maybe testing methodology and split samples and all that, but he, trusted the lab that he worked with and basically attributed it to early life experiences, like we talked about C-section and breastfeeding and antibiotic exposure and so forth. So, I don't know what the approach is. I mean, in theory, you eat a more diverse diet, more vegetables, more tubers, and you can increase the diversity that way. But, maybe for some people, it may be fecal microbiota transplantation, maybe the answer.
Right. Yeah, I heard that interview, and she had ulcerative colitis and was much more symptomatic, but they were both eating the SCD diet, and his looked great and hers didn't look so great. And I feel like we have some answers, and yet we don't know, for smart as we are, we got a long way to go still.
Yeah, no, that's interesting. Great, Tracy. Well, before we go to final questions, anything about SIBO or the gut or gut-brain axis that you would like to share that we didn't get to discuss?
I think I have one thing, maybe more. Well, so if we're going to, I don't know if we fully talked about outside of the box things. We haven't talked about adhesions. So pretty interesting to me is that when people fail, they've done the SIBO treatment and their drug of choice. And if they fail fairly quickly, Dr. Pimentel says that you have to really think about adhesions. They did a nice little segment at this year's SIBO symposium about adhesions. They most commonly, of course, come after surgery, but you can also just get them from trauma, like we were talking about, inflammation and infection. So if you have that inflamed gut, perhaps you just can create adhesions. Certainly not my specialty, but kind of on my radar. And I think people need to think about that. And the other thing that I see so commonly is that we're all trained in functional medicine to treat the gut, treat the gut, treat the gut. And I love that Datis says, don't forget who's in charge of the gut, and to really think about that brain-gut axis. The brain talks to the gut. It becomes that vicious circle, because if your gut becomes a sludgy pond, then it's, of course, making those endotoxins and going to the brain, and given, now you have a two-way street of gut-brain and brain-gut axis. But I think that's really critical to not just assume, to really think about the root causes and where this all came from. I think it just can't be understated. And again, I feel like the easy part is to say you have SIBO and let's pick, an elemental diet or herbs or your antibiotics. But the hard part is to start doing antibody testing, smart pills, motility studies, looking for adhesions. It's a big deal. So anyway, yeah.
That's great. I have a friend, Dave Peterson. He's a chiropractic physician in the California area. And we met back in 2010, and he was talking about adhesions back then, and has a whole, I think he's publishing a book, I think this summer actually, on adhesions. And I never heard anyone else talk about it besides you and him. So I think that's a totally under, recognized, but critical aspect. And done some research in the gut about creeping fat. And so we know that people with inflammation tend to have a lot of fat just on the adjacent side of the epithelium and mucosal layers and so forth. And it starts to build up and around. So, if you do have dysbiosis, small intestinal bacteria, overgrowth, motility issues, and maybe sit a lot, have a little bit of visceral fat, so your intestines are being crunched, then we can get these adhesions, and those can really affect motility. And so he has a lot of research on this and has worked with gastroenterologists, and it's fascinating stuff. And he was way ahead of this. So if you guys are wanting to learn more about that, he's coming on the show in August. And so we'll dive into that.
Read his book, because I don't think I quite understand the mechanism. In my head, it seems like it must be sort of like a P-trap under your kitchen sink, where the intestine comes and then kind of drops down and comes back up or something. But beyond that, I can't really figure out. I don't know how adhesions really are altering and contributing to this. I did write right away to my massage therapist and said, do you know how to assess for adhesions? Do you know how to fix them? The people they had at the symposium were from Florida. Their clinic is called Clear Passage, and they do a technique called the WURN technique, WURN. I don't know what that is, but if you're a massage therapist, you can look it up. And I think what's going to need to happen is more people are going to be able to need to assess for this. And doing a barium study, if I understand that right, really isn't done that accurately. So we don't have very good ways. It takes a very good radiologist who's willing to do 28 scans of each segment of the intestine as you go through, and they have to use their paddle and move stuff around. And I guess that just isn't that, when they do it correctly at Pimentel's place, but that's because he's in charge. If you just go to your run-of-the-mill clinic and say, I want to find out if I had adhesions, apparently they just give you a couple pictures and say, no, you don't have adhesions, and and that's not adequate according to the experts. So again, as a nutritionist, I have all these pieces, and sometimes my job is just to send people to the right places. Like I have all the information, and it's kind of, I do know how to treat it all, either myself or, send them back to their doctor. But sometimes they need to know, go get a smart pill, go get, 28 radiographs so that we know if you have adhesions, and, anyway.
Yeah, great information there, Tracy. But I think, for people that are listening, and I think all of us may be susceptible to adhesions based upon what I've, heard from Dr. Peterson and so forth. But so I think the kind of the bottom line is maybe have prevention and so forth. I think standing is great, reducing your belly fat through exercise and moving your core a lot. I think that's to keep that creeping fat from kind of sticking around. And you talked about the mechanism of how does it work. I think it's just that inflammatory matrix there just starts to kind of congeal. Again, I could be wrong on this, but that's what Dr. Peterson has said. And so he uses things like proteolytic enzymes. He's found to be pretty effective in different enzymes to help break things up. So anyway, we'll learn more about that. So Tracy, I have a couple of questions here. Sorry, go ahead.
No, they didn't really elaborate in this year's presentation. They just said they don't really unadhere all on their own, and like it was only this manipulation that you could really get them to do that. So I'm definitely open to learning more about that.
Interesting. Yeah, I think one of the enzymes, serrapeptidase, it's a silkworm-derived enzyme. I had some great research for breaking up mucin and different, soft tissue inflammatory, type, congestion, I guess would be the right word. So anyway, you can check that out. Serrapeptase is the enzyme. So Tracy, with a couple final questions here. What's your morning routine like? We know that very successful people have routines and do things. So share with us your ideal morning, what that looks like.
Well, ideally, it would take me till about 11 o'clock before I could be in my office. So I'm a big believer in just sleeping in until I feel like waking up. I'm super spoiled, but I don't have to commute. I don't have to usually get dressed up. So I usually wake up about 7 or 7:30. And I guess ideally, I'd like to do my heart math. I'd like to go to the garden and pick my greens and then do a green juice and cook some breakfast. Exercise. I do prefer to exercise in the morning. But in the middle of all that, don't forget about that 35 acres in the farm. So the chickens need to be fed in the morning and they need fresh water. And depending on the time of year, the cows need to be fed and either break their water or they need more water because it's hot. And so it's the one thing I could really work on. And you kind of taught us that in the class I did, was that it's that one thing you could do to really get your day off on the right foot is to do all those things. And I have yet to really sit down and say, like, in my head, I have this checklist of like, okay, I'm going to get up, I'm going to do 12 minutes of heart math, I'm going to, do my stretching, do my workout, and you know what I mean? But I haven't got there yet. It can be a little random.
Sure. I think that is for everyone, but in an ideal world, yeah, you do all those things. But I think it's great that you're out there and getting some natural sun, which will help reset your circadian rhythm and keep it on track, and having purpose and feeding animals. That must make you feel really good, and being outside and getting that fresh air and exercise. And that's awesome. So if there was one herb, nutrient, or botanical, what's your favorite? Maybe you're going on vacation, going on a trip of some sort. What would you bring, and what do you recommend to your clients and patients?
You know what? I maybe would pick a fresh green juice. You said herb nutrient, but I mean, why not food, right? Couldn't
It could
food?
be, yeah, it could be whole food or anything, just something that you feel that is, there's just really, if you were to put your herb nutrients or botanicals or whole foods in a hierarchy, what's the one thing that you think is the most
So out of all the things I do and eat and drink, I feel like when I'm juicing every single day, green juices, I don't put any fruit in it, but just green stuff. I feel like that's when I feel the best. So, and when I travel, I actually think about those kinds of things. Like I'll find a Whole Foods and either buy some fresh juices or, whatever. But that is kind of the thing that I think about. If I could do every single day, that would be great.
Fantastic. I agree with that. I feel much better if I as I do smoothies, with like collards and Swiss chard and spinach and stuff like that, and zucchini. I think that's a great way. The greens just make you feel so good. And I don't think it's placebo. I think it really does affect acid balance and pH and all the phytonutrients there. So great info, Tracy. So final question, if there was, you were to bump shoulders with a future president or maybe Barack Obama in an elevator, what sort of health or lifestyle tip would you want to bend his ear about and let him know, maybe so that he could share with Americans and possibly influence some policy around? What would that tip be and why?
I could go on for a long time in an elevator, but I think we have to get to the root cause of things. And we've got to get genetically modified food out of our food system. I really resent that he campaigned against GMOs and it's 8 years later and we still have them. And I just feel like in my gut that they're not eating genetically modified food in the White House, and yet we cannot pass a law here or get anybody to get off their duff about labeling genetically modified foods. Even if you don't care about them one way or the other, the people who do want to know, I just don't understand why we can't label GMOs. And I think our whole healthcare system is broken. It's changing. The fact that we've got Cleveland Clinic, Texas now is doing some integrative or functional medicine in their training. But I really do think I would bend their ear a little bit about how we spend a lot of money chasing symptoms and we're not really getting to the root causes. And I think it's why if you are trained in functional medicine and you are willing to spend some time with people, that you end up with a waiting list in your practice because, people want help and they can't get it conventionally. So
yeah, people are craving it. Absolutely. Fantastic tip there, Tracy. So I'm sure our listeners want to learn more about your work and where they connect with you online. So if you could give us your website and social media channels, that'd be great.
So www.healthylifestylesmt4montana.com. All the social media buttons are there, easy to find. I do one-on-one patients, but I have a long waiting list. And just a couple of weeks ago, I took that little box even off my website because I can't keep up. So that's a little disappointing for people. But one thing I'm headed towards, I guess, is I'm doing more group classes as a result of that. So I have a few more free classes coming up. By the time this gets edited and put out, there'll maybe be one more. But I'm doing a free class on what is SIBO. There's information on my website. There's a purple and an orange bar, and on the orange bar it says free. Well, that's where you can sign up for free classes. So I'm doing a free class on SIBO, really encouraging people if they're in that, I don't know what I have, I just know I'm sick, to go get a lactulose breath test if the shoe fits, and then starting to do more of this in a group fashion, because although medicine needs to be individualized and personalized, 80% of what I tell people is going to be the same. And then I'm encouraging people just to do what I call Ask Tracy sessions to kind of personalize it. But it really, it lets me help more people at one time. So anyway, that's my website, and that's kind of where I'm headed, is that you can't keep up if you stay up with the research and are really trying to do stuff. And I don't mean that at all. I say that trying to be very humble. It's just true that, I'm sure you see this too, that if people are really good at what they do, you end up with a big waiting list, and then you have to turn to other measures in order to try to continue to help people, because you can't just keep throwing one sandfish into the ocean, when there's 10,000 of them.
Yeah. There's so many people that need help, and people like you who are constantly learning and growing are hard to find. So people are going to seek you out and so forth. So Tracy, thank you so much for coming on the show. Love talking with you about this, emerging topic of small intestinal bacterial overgrowth. You shared a lot of fascinating tips. So keep up the good work.
Hey, thanks, Mike. Thanks for having me. This was great.